Good morning. It's Monday, May the 11th. Welcome back. I hope everyone had a wonderful Mother's Day and that our dining services team took good care of you and that you were able at least to spend some time virtually with your kids. It's good to be back, and we're going to jump right in this morning by going directly to the board. So the chart we're going to start with today is the total number of people who have been tested in Pinellas County. You can see the number up there in white is 20,999 tests, of which 861 have been positive. That means that there are 18,883 that are negative. As we've talked about in the past, that is how we eventually will defeat COVID. When the number of people who are testing negative or have had the virus and are recovering begin to exceed the number of new cases and the individuals who are sick. You can see that our percentage rate of positive to total test is about 4.1%. So that number continues to drop. Early part of last week, it was 4.8, and then we saw a gradual decline over the last 4 or 5 days. When we look here at the center of the map, you can see and track where the outbreaks, the large outbreaks have been. Hillsborough County, this is us here in Pinellas County. The bigger dots are Miami, Coral Springs, West Palm, Orlando, and Jacksonville. So that has not changed too dramatically. We continue to see improvement here in Pinellas County. This is a chart that is really significant. This is the number of individuals who are testing positive through laboratory testing for COVID. This gradually went back up, and then when the governor decided to start talking about the reopening of Florida, we saw the gradual decline. This is data that is 6 days old. It runs its positive and negative tests. The negative tests are in green, and the positive tests are in red. Notice that the percentages have not changed very much. It looks to be about the same ratio of people testing positive to negative, but here's what has increased. Look at the gradual increase in the number of testing. So our testing capacity is increasing, which is important to note. This next map is the COVID data and surveillance dashboard by zip code for Pinellas County. And I'm looking here at 33759. You can actually see Regency Oaks right there. It's only significant in looking at the color. This light blue is fewer cases of COVID. Some of the dark blue areas that surround us. It just gives you a visual graphic of where the COVID, where the virus is spreading based on the number of cases. So the last thing we want to look at is we're going to look at for the state of Florida, and it's more data and surveillance right off the dashboard. And there are a couple of things. Here's the emergency doctor visits with influenza-like illness, steady decline since 3:30. This is the number of documented new cases, steady decline since 3:30. So we know that social distancing is making a difference, and it has been able to stop the spread of the illness and start to get us back to some sort of normalcy. Here are last one of the charts that I want to look at is, again, this is percent positive for laboratory testing. And remember I told you on the previous slide that the ratio to positive to negative didn't really look much difference. and you can see it goes from about 2 to about 4.12%. It's gradually declining, but over a period, this is over a almost 2.5 month period, you don't see much of a decline. All right, the next thing we're going to take a look at this morning is the mobility tracking data. And this is sort of scary, but mobility tracking is based on cell phones. And your cell phone data, it's not individualized, but it's taken in aggregate. But the government is able to look at where cell phones are going. They're able to track it by the state, by the county, by zip code, by address. And so, for instance, if you have your cell phone with you and you leave campus, the government can see where that cell phone went. Now, Big Brother is not looking at it on an individual cell phone basis. They're just looking at it in aggregate, so it's large data trends. But it tells us something about the spread of the virus. So we're going to take a look at some mobility trending and see what it's showing. Okay, so here is the mobility tracking for Pinellas County. And I want to first start by showing you what the graph actually shows. Right there in the center of the graph is the baseline, and that's the amount of traffic that happens on a regular routine basis. And so we're going to look first at retail and recreation. This is mobility, people who are moving to restaurants, cafes, shopping centers, museums, libraries, movie theaters. And you can see the baseline. It's the flat line right in the center. And then since March 21st through May 2nd, that's our target range, you can see that we're about 40% below baseline. Exactly what you would expect because of the stay-at-home orders. The next graph is groceries and pharmacies. It's down about 14% to normal. Again, sort of what you would expect. Grocery stores and pharmacies are considered essential businesses. People are still out and about and going to groceries and pharmacies. Parks are down 31%. These are beaches, marinas, dog parks, public gardens. Again, pretty much what you might expect given the fact that we have stay-in-home orders in place. We're going to go down to the next page. Transit stations are down 53%. This is buses and large public transportation. Workplaces are down about 32%. More people are able to work at home than the baseline. That doesn't work real well here at Regency Oaks because we are a service organization and what we do can only be done in person. But for the rest of Pinellas County, you can see that the mobility is down about 32%. This last one is the residential tracking. These are individuals in Pinellas County who are leaving their homes to go to anything, whether it's recreation, physician, pharmacy, groceries. That's up from baseline about 11%. That last week, that was up about 7%. That's when the phase 1 limitations started to be released. And you can see it has grown Monday over Monday from 7% to about 11%. So more people are out and about, more people are getting back to the community life, but we will continue to monitor the mobility and see how that increased mobility does impact the number of new cases and the number of people who are testing positive or showing up at the hospital with COVID-like symptoms. Okay, so we've overwhelmed you with statistical data this morning. That's why our happy face has hidden his eyes and said no more. And let me just give you a couple of updates in terms of what it looks like locally. Here in Pinellas County, we're at 861 cases with 60 fatalities, relatively small increase over the weekend. In the United States, we've surpassed 79,528 deaths, and so that number continues to go higher with each passing day. In terms of what's happening here at Regency Oaks, in the independent living, we currently have 14 residents who are in quarantine. 12 are because they came back from the hospital and they have been put into quarantine. One is related to a new move-in, and the other is related to an individual who went away on vacation and returned. All of those scenarios require a 14-day quarantine. And over in the skilled nursing, we have 10 residents that are on quarantine because they were recent admits from the hospital back to skilled nursing. None of those individuals are suspected of having COVID. None of them are showing symptoms, either flu-like or COVID-like symptoms. And the same is true of our associates. We're currently not tracking anyone on staff for COVID-like or flu-like symptoms. Our confirmed cases continues to be 1, and patient 0 is still in the hospital. He has tested negative for COVID. He's had 2 multiple repeat tests where he has been negative and is being remained in hospital for other non-COVID related issues. So just 2 other updates that I wanted to share with you. Perhaps you saw the governor issued another executive order last night as it pertains to our skilled nursing and assisted living. The governor is now requiring that all associates who work in assisted living or skilled nursing be tested. So either the National Guard or the Department of Health will be showing up here at Regency Oaks to test the associates who work in our skilled nursing and assisted living. Remember, that's the biggest risk for all residents. It's those individuals, whether they are family members, friends, or staff members who are out and about in the community and coming back to Regency Oaks. And are they coming back disease-free? Now, our associates, we're pretty comfortable with because we have a baseline. We've been tracking temperatures on associates 1 or 2 times a day for almost 2.5 months. So we have a really good trend line that we're able to take care of early intervention if there are symptomologies that we're concerned about. We did notice a significant increase in outbound traffic from residents over the weekend. It was Mother's Day. People were very likely going to celebrate Mother's Day with their adult children, or perhaps go to local restaurants. And I appreciate all of you checking back in and logging in, getting your temperature checked. But there was a pretty significant increase in the number of people leaving campus. It's just very important that you practice good social distancing and proper personal hygiene if you leave campus. Wear a mask if you are around others who may be coughing or sneezing, and just be careful out there as you go out and about. The other thing that will happen today, Governor DeSantis is scheduled today to release more restrictions. We are in day 8 of phase 1. Phase 1, as you recall, is a 14-day period. And today it is expected that he is going to release personal care restrictions. So those individuals who provide non-essential services in a home, massage therapy, perhaps. And then the second category is hair salons are expected to be opened along with barber shops later this afternoon. So we'll continue to track that on a day-to-day basis, and then we will enter phase 2. If these trend lines continue to be this positive, we will enter phase 2 on the 15th, which is this Friday. So we'll continue to monitor that and see where we go from here. That concludes all of my remarks for today. And everybody continue to be safe, and we'll see you on Wednesday.